This is what you can expect if you are birthing in the hospital in the United States. I am Shelby. I'm a former labor and delivery nurse, a current doula, lactation consultant, and mom of two. I have had 2 unmedicated hospital births, and I've also attended hundreds of births in my professional career. So I figured I would give you a little rundown of what you can expect when you are heading to the hospital to have your baby and what your labor and delivery experience might look like. When you go into spontaneous labor, you are going to let your provider know when your contractions are consistent and growing in intensity. We usually say the 5-1-1 rule is when you would call your provider. So your contractions are 5 minutes apart, lasting 1 minute for 1 hour. We really want to see that consistency. If they're bouncing all over the place and they're like 15 minutes apart, 10 minutes apart, 5 minutes apart, 3 minutes apart, 15 minutes apart, then it wouldn't quite be time to go, most likely. Let me give a little disclaimer that everybody is different. So if it isn't your first baby, you definitely want to take your last experience into mind when you are planning when to head to the hospital, how fast your last birth was, and go based off of your intuition and what your body is telling you. But in general, the 5-1-1 rule will get you to the hospital at an ideal time where you're not there too early sitting around and potentially getting unnecessary interventions, and also not waiting too long that you end up having a baby in the car or having a baby at home unintentionally. You'll want to call your doctor when contractions are consistent and getting more intense. Your practice will have an on-call provider if there's more than one provider that you see, and you'll call that on-call number. Usually it'll be an answering service. You'll chat with them first, then they will let the doctor know what is going on, and the doctor will call you back pretty quickly. Based off of what you're telling them, they will let you know when you should head to the hospital. Usually if your water breaks, they will want you to come sooner rather than later. Other than that, they will let you know based on what you're saying, how quickly you should go to the hospital. When you arrive to the hospital, it'll depend on what time of day, most likely. A lot of hospitals have the front entrance open until like 8 p.m. You should check with your specific birthing location to see what time their front lobby is open until. During daytime hours, you'll go to the front lobby and check in. And during the night, you'll likely go in through the emergency room because it's open 24/7. So nighttime hours might be a little bit different depending on your location. Some places do just have the front lobby open 24/7 if it's a bigger hospital and they have staffing at the front desk the whole time. So that would be a great question to ask during a hospital tour, or to your provider, or to the nurses that work at your facility, so that you know what to do when the time comes. So you'll check in at the front desk, tell them that you're in labor, going up to labor and delivery. It's helpful for your birthing partner to talk to them if you're having contractions and aren't able to talk to them yourself. Make sure that they know all of your information so they can provide it to the people checking you in. And then depending on the scenario, they might wheel you over to labor and delivery, but it is up to you. If you would rather walk, you can totally do that, but they will usually give you the option to use a wheelchair. They'll bring you to labor and delivery. You'll stop at the front desk where the charge nurse is, and she will check you in, get your information, and put you in your labor and delivery room, or triage you, put you in a triage room. So depending on what is going on, like how active you are in labor, or if your water broke, or if you're having any other health concerns, will determine if you're going to go to triage or straight into a labor and delivery room. The staff might recommend or ask you to change into the hospital gown. It will depend on your preferences. Sometimes it is easier for them to check you and do what they need to do if you are wearing a hospital gown, but it is up to you if you feel comfortable doing that. So you can wear your own gown, your own clothes while you're in early labor, and obviously don't need access to your bottom half. Once you get closer to delivery, you will have to lose your pants at some point. Your provider will also offer or ask if they can check your cervix to see where you're at in labor. Sometimes, depending on your birthing location, the nurse will check your cervix. There will be 3 things they're checking for. They're checking for cervical dilation, so that's between 0 to 10 centimeters. They are checking for cervical effacement. That is how thin your cervix is, and that's between 0 and 100%. and then the station of the baby. So where is the baby located in the pelvis? Some people do -5 to +5. Some people do -3 to +3. The minus is baby being high up in the pelvis. The plus is when baby is low in the pelvis and close to delivery. Again, this is a preference thing. You totally can decline all cervical exams if you please, or you can ask for cervical exams as you feel fit. If birth is not imminent, they will check your cervix periodically to see what progress is being made and make care plan suggestions based off of what your cervical exam is. If you are GBS positive, they will order antibiotics for you. It's usually penicillin if you don't have an allergy. And in order to be adequately treated for group B strep, you will get 2 doses of the antibiotics in labor 4 hours apart. So if you are GBS positive, they will recommend you get to the hospital sooner rather than later to make sure that you can get those 2 doses of antibiotics 4 hours apart before baby is born to consider you adequately treated. So that's another thing to take into consideration. If you are using a doula, check with your provider when they can join you. Usually they can come right in with you as soon as you are walking into the hospital. Sometimes they have the doula wait until after you are triaged and admitted, but this is something that you can also advocate for if it is something that you are passionate about and you want your doula to be there with you the whole time. Definitely voice that to your provider because you should be able to have the support you need during your labor. So check with your provider on that as well. You can even do this prenatally so you have a plan of what the admission process will look like. During the admission process, you can let your nurse know of any preferences you have. You can provide your nurse with the birth plan. You can also go over it with your provider, but the nurse is really going to be the one who's with you throughout the whole labor process. She will be likely one-on-one with you or maybe have one other patient, but as things progress, she should have just you as a patient, and she will be the one doing the hands-on care. So giving you medications, doing position changes with you, checking your vital signs, checking on baby, doing your monitoring, and then anything that comes up, she will alert the provider of. And if there's anything that the provider needs to check on, then they will come check on you, and they usually check on you periodically throughout labor as well. After that, you're either going to be in the triage room hooked up on the monitors to determine where we're at in labor and if you're going to stay and get admitted, or straight into a labor and delivery room. They will give you a wristband with your name and date of birth on it so that they can identify you. Then you will fill out a consent form for treatment. They'll do a whole list of questions, your admission questions, to make sure that they have the whole picture of what's going on with you, your health history, personal history, your pregnancy history, your birth history, your family history, all of that good stuff. So it'll be quite a few questions. They will also insert an IV somewhere in your arm. Usually we tend to stick away from your AC right here, the bend of your arm, because during labor and delivery, we want you to be able to move around. And also if you plan to breastfeed and even just holding the baby, it's hard when you have an IV right there in the crook of your arm. So sometimes they'll put it in your kind of wrist here, your hand, your forearm. Sometimes the only place they can get it is in the AC, so definitely an option, but we try to not go there if we have other potential spots. Depending on where you're at in labor, sometimes you'll get IV fluids, either for dehydration or if you're planning to get an epidural. If you have other health problems, if you are GBS positive, so you're getting antibiotics in labor, those are some reasons why you would have fluids running. Otherwise, you would have a saline lock, which is when they put in the IV, but they just leave it there for emergencies or when you do need medication, and then they just leave you disconnected so that you can move around and you don't have an extra thing to worry about with the IV pole and fluids. When you get your IV, the nurse will be drawing some labs as well. This is to check your blood type to make sure that what is in the system is correct in case you were to need a blood transfusion at any time. They'll also draw other labs depending on what your doctor orders, but a blood draw will happen when your IV is placed. If you choose not to get an IV, which is usually strongly encouraged, then they will just draw labs when you're admitted. Your nurse will also take a set of initial vital signs, so she'll take your blood pressure, pulse, your oxygen saturation, and your temperature. If your water has broken, they're gonna check your temperature more often. Usually it's about every hour. If your water is intact, your risk of infection is lower, so they'll check it around every 4 hours unless there's a reason to check it more frequently than that. You will get on to the monitor, the electronic fetal monitoring. That is when they hook up 2 bands to your belly and they monitor baby's heart rate and contraction patterns. That is called an NST if they do it for a short period. And then you can go to intermittent monitoring after that if baby looks good. If you are continuously on that, we call that continuous fetal monitoring. So depending on your preferences and any health problems you are experiencing, or if the baby is in any sort of distress, then they would suggest that you are on continuous fetal monitoring. If everything is looking good and you prefer it, you can request intermittent fetal monitoring, and then they would just hook you up to the monitor for about 20 minutes every 2 hours or so, depending on the doctor's orders. Once they have you situated, baby's on the monitor, you have your IV, you've done your admission questions, you got your wristband, you've signed your forms, you should be able to move around as you please. A lot of hospitals have birth balls and peanut balls so that you can do lots of active movements during labor, keep that baby moving down, keep baby in a good position, help you get comfortable. So you can walk the hallways, you can use the bathroom as you need, you can shower, use that for pain relief, use the birth ball, peanut ball, do squats, bring the bed up and down, whatever you want to do. So there it is, what you can expect if you go into spontaneous labor and arrive to the hospital in labor to be admitted. Hope you enjoyed today's video. If you did, stick around, hit that subscribe button, and I'll see you in the next one.